Hello, everyone, and welcome to Medical Sauce, where we make medicine simple, memorable, and fun. I'm Dr. Momo, and today we're discussing one of the most confusing topics in physiology and critical care, metabolic acidosis
and respiratory acidosis. Thank you, Dr. Momo. Students often panic when they see arterial blood gas results because they don't know whether the problem is coming from the lungs or from the body's metabolism.
Azula, before comparing them, what exactly is acidosis?
Acidosis means the blood has become more acidic than normal. Normally, the blood pH is between 7.35 and 7.45. When the pH falls below 7.35, we call it acidosis. The important question is, why did the pH fall? Was it because of too much carbon dioxide or because of too much acid or too little bicarbonate?
Let's begin with metabolic acidosis.
Metabolic acidosis happens when the body has too much acid or too little bicarbonate. Think of bicarbonate as the body's natural buffer. If it decreases, the blood becomes acidic. Common causes include diabetic ketoacidosis, kidney failure, lactic acidosis from severe shock or sepsis, and severe diarrhea, which causes bicarbonate loss. The body tries to compensate by breathing faster and deeper to remove carbon dioxide. This is called Kussmaul breathing, and it's commonly seen in severe metabolic acidosis.
So the lungs are actually trying to help?
Exactly. The lungs are healthy. They're compensating for a metabolic problem.
Now, what is respiratory acidosis?
Respiratory acidosis occurs when the lungs cannot remove enough carbon dioxide. Carbon dioxide builds up in the blood, combines with water to form carbonic acid, and lowers the blood pH. Common causes include chronic obstructive pulmonary disease, severe asthma, opioid or sedative overdose, neuromuscular diseases, airway obstruction. Unlike metabolic acidosis, the lungs are the cause of the problem. The kidneys try to compensate by retaining bicarbonate, but this takes hours to days.
Azula, can you give us a simple trick that students will never forget?
Of course. Think of just two questions. Question one, is CO-perf the problem? If yes, think respiratory acidosis. Question two, is bicarbonate HCO3 the problem? If yes, think metabolic acidosis. Here's another memory trick. Respiratory problem equals CO2 problem. Metabolic problem equals HCO3 problem. One organ, one chemical.
Can you compare them in just 30 seconds?
Metabolic acidosis, low pH, low bicarbonate, primary problem, metabolism or kidneys, lungs compensate by hyperventilating. Respiratory acidosis, low pH, high carbon dioxide. Primary problem, lungs, kidneys compensate by retaining bicarbonate.
One final takeaway?
Remember this sentence, metabolic acidosis starts with bicarbonate. Respiratory acidosis starts with carbon dioxide. If you identify whether CO2 or HCO3 changed first, you've already solved half of the arterial blood gas question.
Brilliant explanation, Azula.
Thank you, everyone, for listening to Medical Sauce. If this episode made acid-base balance easier to understand, share it with your classmates. Join us next time as we tackle metabolic alkalosis versus respiratory alkalosis. Until then, stay curious, keep learning, and keep the medical sauce flowing.
Please answer the following question, and we will give you a shout out in the next episode. Today's shout out goes to Osman Abdul Kadir. Congratulations, and see you in the next episode. Bye for now.
Yes.